Dr. Micheals, and this week's skill of the week is going to be laparoscopic port closure using a laparoscopic suture passer. So there are multiple different varieties. I think the most important one to learn how to use is the Carter-Thomason, which is the one that comes with a cone here. Or what I usually use is we just have reusable of the suture passers, and that way you don't have to use the plastic. These cost about $100 each and have a lot of waste. If you can use a reusable one, you're saving a lot of money and helping the environment. So the first way to do this is with the Carter-Thomason, which is the little cone. As you can see, it has two holes on the top, then it has holes on the side. And the holes on the side are to just kind of direct this without having to think much about where you're pointing this. It basically makes the skill much easier. Typically what you're going to want to do is have, if your incision is going transversely here, have the holes up and down so it's perpendicular to the holes. Usually you're going to want to push this all the way in, but for the sake of this model, I have to pull it a little bit out. You're going to grab the suture near the end of the suture passer, and then you just go in through the more superior hole. You want to go in. Keep in mind this is very, very sharp, so you always want to see where the tip of your instrument is and know where the bowels are. And then when you pull back a little bit, it makes this little loop. You let go, and then you come in through the bottom hole. And this is not a very flexible, I can't really use my grasper too much to grab the suture. So with this, you typically need an assistant. Shanna's going to grab the suture and then hand it to me into my jaws. There she goes. And you just pull it up. Once it's up, remember when you put this down, this is incredibly sharp, so be safe. You pull the cone out, and then you're just going to tie that down. If there's still space for you to either put your finger in or to fit the cone all the way in, after you tie it, you need to put another one in. You would just do multiple interrupteds. The way that we do this is similar to the first one. You're going to grab the suture near the end, and we're going to pretend that the patient's head's up here, their feet are here, and here's the port. What I think to myself is I'm going to do a figure of 8. So I'm going to go up and left of the port, down and left, up and right, down and right. So the first thing that I'm going to do is put my finger into the hole. And as you can see, when I do that, I am at risk of kind of poking my finger. So what you do first is you put this in past the skin, then you get your finger in. Then you put your finger into the fascia and pull the fascia the opposite way from where you're going to be going. So I'm going up and left, so I'm pulling the fascia down. Then I'm not really looking too much at the screen at this point. I'm just feeling to my finger and getting where I'm at. And that's because you might have the camera over here, you might have the camera over here. It's a different angle, and it's hard to kind of figure out where you are in space laparoscopically. But if you just do it relative to your finger, it's much simpler. So here I'm just going to go up and left. And it's some twisting as you push, kind of like when you're putting in a port. Kind of pull back a little bit, release. And the nice thing about doing this as well is that you don't need someone to be with you. You always want to have the sharp part on your nail, not on the meat of your finger, so you don't accidentally stab yourself. So I turn my whole body, and then I just went up and left. Now I'm going to go down and left. So I come over here, come in, and then I just go and grab the suture for myself. And you can see this is much easier to manipulate. So now I got these two on this side. Now to finish the figure of 8. We go, put my finger back in. We're going to go up and right. Back in. And then on this side, down and right. And then you have a figure of 8 here, and you tie this down. So it's cheaper. If you get used to it, it's not any harder than using the cone. And the other thing that's really helpful, if you do have bleeding from port, a single stitch with a Carter-Thomason is not a good hemostatic stitch. Doing figure of 8 is much better. So that's another use to have this skill.